I'm Dr. Gowri. I'm a prosthodontist by profession. Prosthodontist is a field of dentistry where we do replace the missing teeth. So that could be one tooth missing or few teeth missing or no teeth at all. So when you don't have a teeth and when you need replacement, that's the specialty that you have to look into, which is a prosthodontics. Okay, when it comes to missing teeth, there can be three groups. One would be one tooth missing, which could be the age range could be anything because of sports injury when a kid falls down and loses one tooth, or say somebody has a decay that's not been looked up for a long time and that tooth has to be removed, or when the tooth has been shaking and it has to be removed and that one tooth is missing. So that's one category. Second category would be missing few teeth, which is mostly because of lack of follow-up or negligence, or when you don't have time to look into your dental health due to work pressure or family commitments or anything, you start to miss one or more teeth, which is few teeth missing. And then when that affects your lifestyle, or when that starts to affect your function, like you're not able to speak well or when you're not able to eat well, and that's when you choose to replace those teeth. So that category falls into few teeth missing. And a good bit of category where there is no teeth, where you don't have any tooth on your inside your mouth, or there would be few teeth that cannot be saved, that has to be removed, and a whole new set of teeth has to be given. So those are usually the common categories that we have: one tooth missing, few teeth missing, and full teeth missing. Okay, when I say no teeth or completely edentulous in our terms, you will always think that it is old age, because we always compare old age with no teeth. But you will be surprised to know that the age range for full arch rehabilitation. Full arch rehabilitation is giving a full set of teeth using dental implants. The age range is between 20s to 80s. Let me tell you the reason first when we lose teeth. First would be syndromes, which are birth defect, where you only have the milk teeth and you don't have the permanent teeth. So in your early 20s or mid 20s, you don't have any teeth at all. So that is the young category. Gum diseases, that can start from 20s, 30s, 40s. Gum diseases are usually not seen at the right time because they are painless. Only when your pain comes, you visit a dentist. Gum diseases don't give you pain, but they slowly progress. By the time it gets to the pain stage, it's almost untreatable. So you'll have to get rid of that teeth and get you a good tooth. So that falls into the 20s, 30s, 40s, the middle age category. And the old age related losing teeth, losing bone, losing tooth because of wear and tear and all that, that is the old category. So no teeth or completely missing teeth ranges from 20s to 80s. Full mouth restoration is when there is no teeth, we give a full set of teeth. That is a full mouth restoration or full arch rehabilitation. Now there are few treatment options for that, which is removable and fixed. Removable option would be the last option that one should look for, because the removable option will be very uncomfortable and it is not as efficient as a fixed one. The chewing efficiency, the speaking efficiency, everything will be relatively very poor compared to a fixed restoration. So fixed restorations are done using dental implants. Dental implants have conquered the prosthodontic field in the past decade or so. Dental implants are titanium fixtures that are fixed inside the bone, which forms the base. So when you want to have a good set of teeth, you should have a good base. So the base is formed by implants and the teeth is built on that base. So that is basically what a full arch rehabilitation is. So anybody who misses a teeth, anybody who miss all teeth, when they have no teeth inside their mouth, they are all eligible for a full arch implant rehabilitation. There is no question about if we have enough bone or if we have. The only thing is your general health has to be good and you are eligible to get implants at any age. We've got 90s, people who are in their 90s who've got implants. So, and in Rajan, we never tell when you don't have bone, we don't have implants or anything like that. When you have bone, you get conventional implants. When you have deficient bone or less bone or no bone, then you get specialized implants, which will be formed according to the patient's bone. So once that is done, when the patient walks in, we do all the investigation that is necessary to build to the next step. So we do an examination, we check the patient as such, examine the patient's general health, and then we do a cone beam CT scan where we try to see how much of bone that patient has. Then we come to the treatment options. So when it comes to treatment options, we have conventional implants and specialized implants. That forms the base, over which teeth can be in any material ranging from acrylic, zirconium. Those are all like advanced materials wherein they resemble just like your natural teeth, and the strength of those artificial teeth are very much comparable to your natural teeth. That is actually a very good question. When it comes to implant full arch rehabilitation, and what we do here in Rajandental, you get teeth within 4 days or 5 days maximum, wherein you don't have to go through multiple surgical procedures, or we don't take bone from any other site to put it inside your mouth where you have 2 places to heal or anything of that sort. What we do is we do immediate implant placement, and it is all digital now. So we have surgical guides. So we plan the implants where exactly it has to be and the teeth that precisely goes on that implant. So the day we place the implant using a surgical guide, and we take an impression, sometimes conventional, sometimes digital, and then we do a trial with the teeth, and then when the patient says it looks okay, we check the function. If the patient's bite is okay, if the teeth alignment is okay, all that we check, and we always get a go from the patient in terms of appearance because they know their teeth well. So when they say that, and we finalize what we have, and then the next appointment we fix the tooth. So from the day of implant placement to the day of fixing tooth, it's hardly 1 week. And after 6 months, for all full arch rehabilitation, after 6 months we change only the teeth, because when we place the implants, we give a tooth that is more feasible for the implants, which is very soft to the implants. So even if you want to, you can't put too much force on the implants. So once after it passes that 6 months time period, then the implants become strong. Now we can give strong teeth using a better material, and we can give a longer teeth set so that the patient can start to function normally. So that first 6 months, patient has to be a little careful, after which they can go back to their original lifestyle and they can enjoy their teeth like how they were doing 30 years before. I would like to tell that missing teeth is not something that you have to adjust and live with. When you miss a tooth, it is always better to replace it as early as possible. You catch it early, treatment becomes simple. Not that when you catch it late, it becomes complicated. Any time, the treatment has become very easy these days. So when there is a missing teeth, don't get adjusted to it. Don't eat food that you can only with your teeth that you have. Because as you age, you need a good set of teeth. People think that when you grow old, it is okay to lose some teeth and you just have to live with it. Absolutely not. When you grow old, you get a lot of medical indications wherein you have to have a lot of food restrictions. So you need a good set of teeth, especially when you grow old. Middle-aged people, again, you have to have a good set of teeth to function well. These days, we're all health conscious and we have to have dietary restrictions and everything. Everything starts from having a good set of teeth. So when you miss a teeth, don't think you have to adjust and live with that. Always make sure you replace it with a good or better tooth so that you can maintain the same lifestyle that you want to. Visit Rajandental, you will reach me.